August 2005. Breaking health barriers. I am in here on the stream as well as K-Talk. I'm Dr. Jack Stockwell in my 31st year at K-Talk Radio. You can believe that. A lot of things to talk about today. I want to talk about what's wrong with medical school education. Not having attended medical school, that may seem somewhat presumptuous. However, the evidence is more than present for anybody who looks at what is going on in an industry in this nation that is owned lock, stock, and barrel by another industry that's even bigger and more powerful. I want to get to that. I want to talk about what's going on with some nursing schools as well as medical schools requiring COVID-19 vaccines. But the big thing, and I usually talk a little bit about vaccines from week to week. But I think you'll find this interesting because the evil that exists in the American Academy of Pediatrics. Again, the evidence is overwhelming. It's beyond argument. I want to talk about that. I want to talk about a new instrument we have in the office, shockwave physiotherapy, for whenever we have, and I'll get into this in more detail, but it's just some nagging shoulder pain, bursitis, tennis elbow, lumbar disc herniation, hip pain, knee pain, medial tibial stress syndrome, Achilles problems, plantar fasciitis. It's a lot of clinics now have this device. We finally got it because some of our patients are getting this treatment elsewhere, and we figured, well, my goodness, they might as well get it from us. A very, very effective form of being able to generate new tissue, especially in the supportive tissues of the body. I want to talk to you about that. And we're offering the first treatment without charge. And we recommend that you get a package of probably about 6 of them spread over 2 to 3 weeks, maybe 4 weeks. But the first one we'll offer just for you to be able to experience it. I think you'll find it interesting, but that's got to be scheduled. Of course, through the office. And then another thing I want to talk about before we end the show, I want to get into vitamin C. There's a big question in the minds of a lot of people about when I talk about ascorbic acid not being vitamin C. Although ascorbic acid does have a benefit in the body, it's not vitamin C, and it shouldn't be used in place of vitamin C. It's a part of vitamin C, just like the steering wheel is a part of the car, but it's not the car. Ascorbic acid is part of the vitamin C molecule, but it's not vitamin C. And then the forbidden question. I want to talk about that before the show is over with. The question that we asked a couple of years ago, we asked it even less than last year, and we don't seem to ask it anymore at all, regarding people who have suddenly come down with some terrible turbo cancer or something else. What is that forbidden question? That's we don't. All right. I think this will probably take us through the rest of the program. So I want to talk about the American Academy of Pediatrics. When it comes to healthcare, and I noticed this with my patients in my clinic. Those of you on the street, welcome this morning. Those of you at K-Talk, welcome. I know I have a tendency to run out in the weeds from time to time, but I just want to express my appreciation because I don't know how much longer I can do, to tell you the truth. I look forward to the Monday and Tuesday shows. I look forward to the health show on Wednesday. I look forward to the show on Thursday, which is a pre-recorded segment from the Doug Stephan show that I understand plays at K-Talk at 4 o'clock in the morning on Saturday, as a part of several hundred radio stations around the country on Saturday. But it's still there. It's been up for a long time. I really appreciate it, and I don't take this for granted. And I express my appreciation to Dick Perry and to Kristen for putting up with me for all these years. This is It's not half my life. I'll tell you, it's approaching. And it's been a wonderful experience to be able to do these things. And so as I talk to my patients, and my patients talk to me for several decades, they want to show respect. And I have patients who call me by my first name. We're friends. I don't need the deal. But a lot of them, if we went to lunch, it would be Jack this, Jack that. But in the office, it's Dr. Jack this and Dr. Jack. And I appreciate that. And I appreciate the respect that's being. However, I have some other patients who I think if I told them to breathe one less breath per minute, with me being as facetious as I can possibly be, would take me literally. And that kind of concerns me because I've been taking care of them for a long time, and they either call, and when they talk to the staff that answers the phone, would you ask Dr. Jack this or that? And it's not serious. It's hardly ever anything serious. They need me to make their decisions okay. And I'm concerned about that because that gets into other areas of their life where they feel some kind of disempowerment in the face of perceived authority. And as those of you who have been listening to both the political and health shows that I've produced know that towards the end of the program, I almost always am saying, please study this stuff for yourself. Don't take this for gospel because I said it. Because those are the people I'm referring to who call the clinic. And given them a particular protocol, let's say for female hormonal support. And of course, we're going to recommend nasal thyroid and a couple other things to go with it. And we'll tell them the dose. I want you to take 3 of these. You spread it out during the day or take it in the morning. Fits your schedule. And they will call and they will want to know, we're going to travel. We've got friends visiting, whatever. How would Dr. Jack feel if I took 4 of them for a few days and then we went back to 3? Now, I don't need to be asked a question like that. They feel compelled to ask that. Now, if it was just 1 or 2 people, I wouldn't worry about it. But there are a lot of people that seem to fall into that category. Now, I want to take that model and spread it throughout the rest of the country when it comes to what the medical world has to say about something. And you see these commercials for weight loss now, for semaglutide and tirzepatide. Very dangerous approach to weight loss because you're absolutely bypassing all the laws of weight loss that Mother Nature created. And you are trying to chemically overcome what nature has provided. Nature has provided a way to lose weight, but it takes some discipline. And it takes a change of lifestyle that you have followed to a certain degree that allowed this to take place, maybe since your teenage years. And when I see the commercials promoting this stuff, and I see the commercials on Fox 13 for this pharmacy in Provo, talking about this safe weight loss program. It's on there every morning. It's on there more than once. Safe weight loss. There's a certain segment of our culture that will hear that and say, well, he's a pharmacist. And most people who have experience with pharmaceuticals know that the pharmacist knows more about pharmaceuticals than the prescribing physician does. So if the pharmacist has something like this to say, safe and effective, without any research, without looking into it, without looking, they'll automatically fall in line and go ahead and get this stuff. And then there's another segment that, well, I think we got to look into this a little bit more, because there's just something that tells me that a once a week injection into the belly with these chemicals to suppress your hunger with the GLP-1 agonist, maybe that's not the best idea. Oh, but honey, I've lost 65 pounds. And this is what my patients tell me who are on these drugs. They come in and I can see them. I haven't seen them in months. They slept wrong, or they had a fender bender, or they've been over in the garden too long or something, and they come in with some pain somewhere. And obviously they've lost weight. I can see it. And I say, hey, I see you're losing weight. Yep, I've lost 65 pounds, was what one person, a lady, told me here the other day. I said, over what period of time? And she said, a year and a half. And it was a dramatic change in her appearance. And I said, well, what are you doing? Oh, I'm on tirzepatide. And I said, you feel pretty good about it? Oh, yeah, I feel tons better. Having lost that much weight, more energy, more get up and go. I said, how's your brain? She said, my brain's just fine. And I said, well, how is sleep? Oh, I'm sleeping better than ever. And you're getting out of the house. Oh, I'm getting out of the house and getting involved. I started playing pickleball. And so all the outward signs that everything is okay. And I said, how much have you studied this drug? And she said, well, you know, I've, my doctor told me all about it, and you know, this standard stuff. And I said, you haven't really experienced any side effects? Oh, no, well, occasionally there's some nausea. And, but she said, I was experiencing nausea before that anyway. Before I started. And I said, you're happy with this? How much weight do you want to lose? And she said, well, I was clearly more than 100 pounds of weight. So she said, I'm hoping to lose another 35, 40 pounds. And then what are you going to do? Well, then I probably will stop. And I said, well, what about those commercials on TV where that last guy, as they go marching down the street at the 4th of July parade, and he says, I've lost so much weight and I'm keeping it off. I said, are you going to continue to use it on maybe somewhat limited to keep off the weight? In other words, what's not being said is, so you can go on violating the food laws of Mother Nature. In other words, continue eating overly processed foods, super processed, ultra processed, whatever, and the stuff that made you obese to begin with. You're going to continue to munch on that stuff. So you're going to need to continue to take the injections so you can continue. Now, I didn't say this. That's what's going through my head. I didn't say it to the patient. I was a little more subtle than that. And it was just like, yeah, you know, it's just like, well, I started drinking organic tea. It was just like it was nothing. And so I told you all, I'll tell you this. Even for those of you who aren't using chemically induced lifestyle changes, so that the violation of the laws of nature can continue and still lose weight, it's the submission to authority dressed in a white coat and a stethoscope hanging around their neck, as though they are the last word in healthcare. Now, I began to realize in my early 20s that wasn't the case, but still, I felt the same intimidation that everybody does. The white coat impression, the white coat brother. Now, again, as I said, I said all that to tell you this, that the American Academy of Pediatrics is pushing COVID-19 vax now for all infants. Now, even though an infant is incapable of producing antibodies, They're still going to do this. Now that, from my perspective, either they don't understand immunology, or they do, but because of all the money the American Academy of Pediatrics gets from pharmaceutical companies, they're going to continue the lie. So, because it's heavily funded by pharmaceutical companies, they recommended on Tuesday of last week that young children, including infants, receive the COVID-19 vaccine despite the fact that all during the COVID years, starting in 2020, children are minimally impacted by the virus. In fact, the virus doesn't prevent one from contracting it. That it largely only helps the elderly and the medically fragile for severe cases. There's some evidence that that might be the case. But because kids were never really seriously impacted unless they had some terrible comorbidities. The child had cancer or some cystic fibrosis or some other horrible condition from birth. Healthy children weren't bothered by it at all, just as they're not really bothered by colds or flus that you get from coronaviruses, which is what COVID was. Now, according to the American Academy of Pediatrics, all children ages 6 to 23 months should receive the COVID vaccine, regardless of whether they have natural immunity from prior infections. Now, I know some of you were working for companies at the time, a few years ago, when you were required by your company to get the COVID-19 vaccine. And some companies were late to the dance as others. And you already had COVID. And you went through a week or so of cold and flu symptoms, and you got over it, and you were just fine, and you were ready to get out of bed or get out of the house and get back into work or whatever. And believing some of the theories of vaccinology, since you had COVID, you should have antibodies. You have Mother Nature's best protection against further infections. But your business that you work for wouldn't accept that. They said you had to get the shot anyway. Why did you have to get the shot anyway? Because the FDA said so. His Royal Highness Fauci said, despite the fact that you may have had COVID and developed natural antibodies, you still should get the shot anyway. Now, all the stuff I said there at the beginning about my experiences with my patients and how they submit to white coat authority, many of you didn't. Many of you are just fine now. Many of you didn't even get sick. I never got sick one day. There was a day I swore I experienced vaccine shedding. I can still remember what room it was in the old office. I can remember the lady laying on her side and me slightly touching the side of her neck. And I can remember this cold chill, this invasive feeling that came over me for several seconds. After I worked on her, I went straight into the kitchen of the office where we had several open bottles of standard processed products for the immune system. And I wolfed them down and then went back to work. We at the time had bottles of various types open for samples for to try out. And I took them, and I took them vigorously. In fact, I took enough to make up my lunch in a day. And then I was fine. I never suffered any consequences, never got sick, never exhibited any kind of coronavirus symptoms, which is cold and flu symptoms. Now, if you have been exposed to some kind of naturally occurring bacterial or viral infection, especially in the upper respiratory tracts, you develop a great sense of immunity, which is one of the reasons why, as children, we go through mumps, measles, chickenpox, various things that can bring on a fever. After a few days, after some diarrhea or vomiting or some sinus problems or whatever else, and fever. And fever isn't bad. Fever isn't bad till it gets over 104.5. In fact, I know a pediatrician that says a child doesn't even have a fever until it's 103. That's real advice to the parents of these children. Don't worry about a fever up to 103. It's just the immune system turning on the body to further empower and stimulate the immune response. But obviously, sometimes it can get out of control. If it gets up around 105, then it's dangerous, because at 107, it can kill. How does it kill? It destroys proteins and destroys nerves. So back to what I'm saying here with the American Academy of Pediatrics. Despite the overwhelming evidence of the ineffectiveness of the COVID vaccine in the sense of effective and safe. If it was effective, why did you need multiple boosters? If it was safe, why do we have such unimaginable numbers of deaths and serious side effects that will affect the living the rest of their lives, as reported by the CDC? And yet, in lieu of all of that, the American Academy of Pediatrics recommends all children age 6 to 23 months, half a year up to 2 years, should receive the COVID-19 vaccine. Unless, of course, there is a caveat in there. They have contraindication, such as a history of severe allergic reactions to some ingredient in the vaccine, like aluminum hydroxide or mercury, of course. I don't think there's any mercury in any COVID vaccine. But the next worst neurotoxic mineral, aluminum, is. So, despite the fact that a 6-month-old child cannot form antibodies, they push this anyway. And I know I'm repeating myself when I say this, but the fact remains, either they are ignorant of immunology at the American Academy of Pediatrics and do not know a 6-month-old child cannot form antibodies, or they do, but they're so controlled by the pharmaceutical industry that they have no choice if they want to continue to exist because of the money they get from them. Now, while the recommendation is universal, the group said in a statement that the recommendation stems from infants and other children who are at high risk for severe COVID-19. So, in other words, they lay a blanket out there to cover the high risk children for COVID-19 by including all the other children who are not at high risk, or actually are not at any risk whatsoever, so that they don't miss in some ignorant parent's assessment of whether their child is at risk or not. They risk all the healthy children with serious side effects to not miss that one. Now, in the Epoch Times, it said this: the organization pointed in part to a paper it published that found that among children hospitalized for COVID-19 from fall 22 to spring 2024, the majority of those younger than 2 had no underlying conditions. Now, the American Academy of Pediatrics are the ones who published this paper. Whoops, hold on. I need to mute K-Talk, so I'm just talking to the streamers. So I want you to keep that in mind. It's just amazing. There were no underlying conditions for these children to get these shots. In other words, they were asymptomatic. So of the papers cited, or the I think the amount of children were around 2,500 who were hospitalized with COVID-19. Out of I don't know how many hundreds of thousands that were checked. Those who were hospitalized were children who already had underlying conditions. But the paper said the majority of them didn't. So a spokesman for the Department of Health and Human Services, which is, of course, the CDC's parent, as told to the Epoch Times in an email in which the American Academy of Pediatrics receives funding from vaccine manufacturers, should lay the absolute conflict of interest issue right out on the table for everybody to see. So this is what they said. By bypassing the CDC's advisory process and freelancing its own recommendations while smearing those who demand accountability, the AAP is putting commercial interests ahead of public health and politics above America's children. Now, if that's true, and getting back to this white coat superiority thing, if the superior white coats who we surrender parental responsibility to making health decisions regarding our children can be at such error in their advice to America's children and their parents, where else are they wrong? Now, in May, under orders from Health Secretary Bob Kennedy Jr., the CDC stopped recommending the vaccine for healthy children and pregnant women. I was going to do in the past a show on pregnant women who got the shot, and we know the tremendous increase in miscarriages in the first and second trimester if they got the shot. Third trimester, there didn't seem to be as many as miscarriages. But the children developing in the third trimester, before birth, obviously, from a mother who got the shot in the third trimester, now are developing these same white amyloid, snaky little things in their bloodstreams. And I was going to do a show on that. It was just too scary. I decided not to do it. But that's showing up all around the planet now. Now, when Bobby Kennedy told the CDC to stop recommending COVID vaccine for children and pregnant women, healthy children and pregnant women, which would imply it's okay to give it to a sick child, you never, ever, ever, ever vaccinate somebody who's sick. There is no argument whatsoever. The immediate effect of injecting these chemicals into a human body is to be immediately immunosuppressive. It suppresses the immune response to this injection. In other words, you're blasting the body with these horrible chemicals, this terrible poison, and the immune system goes after it, and goes after it with such fury to clean it out of the body that it becomes suppressed in its overall strength, leaving the victim open to some other kind of contagion. How much research do we have on that? A little bit, not a whole lot. That's something that the Health and Human Services should be looking at intently. But the CDC schedule currently states that children with moderately or severely compromised immune systems should get the vaccine, even if they've been vaccinated before. Can you see the insanity in what I'm talking about here? And the power of the pharmaceutical industry over truth? Now, why did the CDC stop when Bobby Kennedy told them and the American Academy of Pediatrics went right ahead? Because the CDC works for Health and Human Services. Bobby Kennedy's their boss. They do what their boss told them to do. But he doesn't have authority over the American Academy of Pediatrics. So they came in through the back door and just, countermanded what Bobby Kennedy had to say because, well, Bobby Kennedy isn't a doctor. As though a doctor knows something. Again, it's that white coat superiority. Now, despite the fact that emergency rooms around America save hundreds of lives every day, does not automatically confer upon modern medicine infallibility. Now, the AAP has said they will continue to provide recommendations for immunizations that are rooted in science and are in the best interest of the health of infants and children and adolescents. There's that science word. And because somebody in a white coat uses the word science, we assume that medical doctors are scientists. I don't think so. I have, as I've said on shows before, I have a couple of medical doctors that I consult with concerning my body. Two ladies that take care of different parts of me, and one of them is a DO, so she was trained somewhat in nutrition. And when I bring up a couple of the subjects, I don't think she ever disagreed with me. I think she agrees with everything that I've seen. And I pretty well agree with most things that she says. And she tries to use the natural approach to lifestyle change. You know, she says, if I have to prescribe drugs, I prescribe drugs, but I really, really push lifestyle change. The other doctor, I think, relies too much on synthetic supplements, but we have pretty much the same philosophy when it comes to healthcare. Again, lifestyle change. It's the lifestyle choices that make most people sick. And by changing those lifestyle patterns, you can reverse the sickness. Now, the American Academy of Pediatrics has 67,000 members. And its funders include Pfizer and Moderna, which manufacture 2 of the 3 COVID-19 vaccines that are available in the United States. And the government narrowed its recommendations for COVID-19 vaccines. The AAP and some other organizations together said they were worried that insurers would stop covering vaccines for children and pregnant women if the CDC, in fact, stopped recommending it, except for severely sick. And again, that's not who you give the shot to. So what the government has done, I don't know that they have the authority to do this, but many insurers, as well as Medicaid and Medicare, are required to cover vaccines in the CDC's schedule. What is that? Cha-ching. There it goes. It's the money. Obviously, it's the money. So the AAP says that they are, and I've carried this on way too long, but I'm really trying to drive home a point here. Just because somebody in a white coat said this or that, and most of us do not have the time to find out the money game that's being played behind what they're saying, I think it's a good default position to take. It's coming from money. And even though there is an overwhelming amount of research pouring out of other countries, not so much in this country, but pouring out of the countries that have universal health care, about the dangers of these drugs. Medicine usually runs 40 to 50 years. Modern medicine in America usually runs 40 to 50 years behind the science before it finally catches up to it. And I know that because I just consulted. I am consulting with a woman in California tomorrow who has been convinced by her endocrinologist or her what I'm not sure the doctor's specialty that she's been consulting with, that she has serious thyroid problems. So I told this person, I want you to go get a complete thyroid panel. And then as soon as you have it, email it to me. Well, I got it yesterday, or it might have been Monday. It doesn't matter. And I'm going through the blood results, the blood work of this thyroid. And I'm looking at the TSH, the thyroid stimulating hormone. I'm looking at free T3 and free T4. I'm looking at reverse T3 and other indicators that are in there, especially the autoimmune factors. They're all normal. They're all within normal ranges of the laboratory. Now, we're plugging those numbers into our symptom survey program that narrows those margins as to what we think normal would be. Maybe some of them might be out of range, but as far as the hospital's guidelines, they're all within range. Yet she's been convinced she has serious thyroid problems and needs to be on some serious thyroid medication. So her sister, who happens to be a NUPA doctor in California and a very close associate of myself, got in touch with me and said, would you consult with my sister about her thyroid? I said, yep, send me the blood work. We got the blood work, as I said. Numbers are they're all good. They're all in the green. And so I got to talk to her tomorrow about why she wants to proceed with this kind of a program. Well, that's what I mean when I say medicine is 40 to 50 years behind the science. And it just because that's about all they know. Now, it was either last week or the week before, I talked about how Bobby Kennedy Jr. is telling medical schools that if they don't start teaching classes in nutrition, they're going to lose the possibility of losing some federal funding. And you'd think that would get their attention. And I've been looking for this, and I haven't seen any more indications that that's being followed through yet. But I think that's a great idea. But it is contradictory to the principles of medicine that you can feel better and the body can work better if it eats better. Now, to you, to me, that's common sense. You stop eating junk, you start eating good foods, you would feel better. But medicine is based on the pharmaceutical concept of living better chemically. The 3 Ds: diagnose, disease, drug. When someone comes in brand new with their presenting symptoms, it's your responsibility to diagnose what's going on by coming up with a disease and then prescribing the appropriate drug. Now, just how deep do you have to get into that before you see the mendacity that's involved with this? When there's no other alternative but a drug. And that's why I think the medical model is failing. I think that's why there's over 70,000 chiropractors in America now. That's why there's an increasing number of naturopaths and healthcare modalities that exist outside of drugs for everything and drugs for anything, because it's simply failing. So even though the CDC only recommends flu vaccines now that are free of thimerosal, they still are pushing flu vaccines. And I know a lady who just got, it's 3 shots. It's the COVID and flu, and I think RSV, if I remember right. All 3 of them in 1 shot. Just got it a couple of weeks ago. And I'm watching her closely. She's not a patient. She's just the friend who lives where I live. Just kind of watching to see what happens. Why did you do that? Well, my doctor said that I should get this to get through the coming winter. Do you feel you couldn't get through the coming winter without those shots? Well, I don't want COVID. You feel that this shot will help you to not get COVID? Oh, absolutely. And how many millions of Americans still think that way, who go back to the collection that I was talking about at the very beginning of the program, who live and die by what their doctor tells them. And I try to avoid that with my patients, as I was using that example at the beginning of the show as well. You know, so what do? Well, I try to, once I am able to reestablish balance in the autonomic system with my patients between the sympathetic and parasympathetic systems, the fight or flight and the rest and digest, get those back into balance, which is the primary work that I do. In fact, I'm seeing a new patient today who's coming in with some long-term severe digestive problems. Why would they go see a chiropractor? Because a lot of us think the chiropractors, and what was this lady the other day? She was laughing. She said, oh, she told a family member that she was coming to see her chiropractor. And the family member said, you mean a cractopractor? I don't think chiropractors have anybody but themselves to blame for that kind of a moniker. And being relegated to back pain, headaches and back pain. Chiropractic is so much more than that. Chiropractic, is at least the kind that I practice, gets down to balancing the nervous system, bringing the autonomic system back into balance. And when you do that, every single system in the human body is affected positively by that. There isn't anything in the entire human physiology that is not affected by the autonomic balance. And autonomic balance is pretty well centered in the hypothalamus. It's an important gland sitting underneath the brain, up in the skull, but it's a part of the brain. And we know through neurological, or just neurology, basic neurological science, the position of the top bones in the neck directly affect through afferent fibers all the way up through the brainstem and the midbrain and the pons right into the hypothalamus. Now, I can get really technical about this, but I'm not going to waste your time. It's just, that's what I work on. Now, do I work on headaches and migraines and back pain and sciatic? Yeah, those are the side effects of just physical imbalance to the skeleton of the human body. And when that skeleton is brought back into physical balance against gravity, and we bring autonomic balance, return autonomic balance through the nervous system, man, life is wonderful. As opposed to living chemically. Now, there are some med schools and there are some nursing schools that still require COVID-19 vaccines, that the students are going into schools this fall. You can't, you just can't seem to get away from it. And while the majority of healthcare programs across this nation have ended their mandatory COVID-19 vaccination requirements, there's still some holdouts. I was checking the other day to find out if the University of Utah still requires it. I haven't been able to find out, but I doubt it. So there's still a few holdouts that are prompting the medical watchdogs to sound the alarm. So the requirements persist even though President Trump issued an executive order back in February to defund schools that mandate COVID-19 vaccinations. And this organization, No College Mandates, is the name of the organization, dedicated to ending the COVID-19 vaccine mandates for college students. Lucia Sinatra, who's the founder of No College Mandates, is calling on federal lawmakers to pass legislation to formalize Trump's order into law. And while the order does not include a carve out of healthcare or science programs, quote, for whatever reason, healthcare students and healthcare programs seem to be governed by different rules than general population student programs at colleges. She says she does not have the exact number of med schools, nursing schools, and health science programs still mandating the COVID-19 vaccine, because unlike the broad mandates from a couple of years ago, they were very explicitly and publicly posted. She said it's somewhat obfuscating. But some definite examples are Texas Wesleyan University's COVID-19 vaccine requirement for nursing students, and other specific examples of these mandates imposed on medical students at Emory University School of Medicine, the Johns Hopkins University School of Medicine, and the Johns Hopkins School of Nursing. Now, you got to stop for a second and ask a question here. For Pete's sake, do they not pay attention to the vaccine side effect awareness program that through the CDC that we now know is only publishing 1% of the side effects of the millions who have been killed by this vaccine, and the extra millions of those who are permanently damaged neurologically or through their cardiovascular or pulmonary systems for the rest of their lives because of this? And yet they still mandate it? Why do they mandate it in light of all this stuff? Again, money. The money these medical schools get from pharmaceutical companies. You just can't get away from it. Like I was saying earlier, we're coming up to a break here before long. You just can't seem to get away from it. So Sinatra said, this happens when the clinical partners with which students would have to complete required practicums or rotations impose COVID-19 vaccination requirements different from those of a student's educational institution or academic program. And the students in a variety of healthcare science programs like the University of Washington, for example, although they no longer require to be vaccinated for COVID-19 to be in the school, they still face requirements from the University of Washington's clinical partners. See, a medical school doesn't exist in and of itself. Even the University of Utah Medical School has clinical partners throughout the state, as well as other states, that work in conjunction with the University of Utah Medical School. And some of these partners require it. The University of Washington Medical School is a major clinical placement site for University of Washington health science students. This is the official word, will not be requiring students placed at its facilities to have the COVID-19 vaccine. Now that's gotta bother pharmaceutical companies when there are medical schools that come out and say, well, you know, we don't really think it's that important. Now, at the University of San Francisco School of Nursing and Health Professions, it says this, quote, nursing students should be aware that all of our clinical partners at which our students may be placed for clinical learning experiences are currently requiring all students to be fully vaccinated for COVID-19 before beginning training and learning at that site. Degree completion may be slowed or stopped if the University School of Nursing and Health Professions students are unable or unwilling to be vaccinated given the requirements of our clinical partners. So what does that mean? It means just what it says. You may not have to have the shot to go to the school, but as you start doing clinical practice as a student in other areas outside the school, in various institutions, in the neighborhoods, health trauma centers, healthcare centers, urgent care centers, whatever else, they may require it. And so even though the school doesn't, their partners might. And if you don't get the shot, you don't get the degree. Consequently, she says it leads to an awful lot of frustration among healthcare students, because you can imagine how those who really want to preserve their health and not get that shot would be scrambling for transfers from one institution to another that did not require it. Now, the executive order by President Trump back in February said this: "It is the policy of my administration that discretionary federal funds should not be used to directly or indirectly support or subsidize an educational service agency, state educational agency, local educational agency, elementary school, secondary school, or institutions of higher education that require students to have received a COVID-19 vaccination to attend any in-person education program." What did that say? We're not going to give you any money if you insist on this stuff. So in a moment or two here, K-Talk's going to go to the top of the hour news. And I want to tell you a little bit more about this new device we have in the office, but I'll save that till after the top of the hour. But I want to get into the forbidden question. Now, I think what I'm going to talk about before that is something that I want to make clear about vitamin C. I don't know why that's still such a mystery for some people. But as part of my job as a healthcare professional, someone licensed by the state of Utah, to make this as clear as I possibly can for the benefit of those listening. So I will try, but I want to finish this concept of these no college mandates, because there are states, individual states that have played up on President Trump's mandate or executive order with laws within the state, within various states. There's a bill introduced by U.S. Representative Mark Mesmer of Indiana that would prohibit institutions of higher education from mandating COVID-19 vaccines for students or staff as a federal law. And the benefits, of course, would provide to general population students if it were passed, as laws are harder to overturn than executive orders. I mean, the next executive order can be reversed just as easily as it was issued. She said she's been reaching out to members of Congress to get them to amend the bill to make sure they include medical schools and any partners of medical schools. She said this: "If it's amended to include healthcare students through the entirety of their program so that they can reach completion, that's a whole different bill. Now we're telling medical schools and their partner hospitals and their clinical partners on the education part of their businesses, they cannot mandate these vaccines because they're college students." So, how many nursing schools do we have in Utah? We have a mess of them. And these schools, of course, are classroom and laboratory training, but the students have to have experiences with patients, obviously. And while there are patients at the medical schools, there aren't enough patients to satisfy all the student requirements. So they have to send the students out to various partner organizations like Intermountain Healthcare, like St. Mark's, like some of the other hospitals, communities in our state. I don't know, because I haven't bothered to look into it. I don't know if Intermountain Healthcare, you know, the hospitals throughout the state up into Idaho as well, require nursing students or medical students who show up in those hospitals for further training to have the COVID-19 vaccine. But this is the big battle. You know, you see the same thing in food. You see the same thing in energy, oil, gasoline. You see the same thing in trade. You know, money rules everything. He who has the gold makes the rules. But when it comes down to healthcare, and that the healthcare policies of this country are being established by boards of directors rather than real, true, incontrovertible science, you end up with the healthcare crisis that we have in this country that we have right now. And I blame medicine. I blame medicine for the rates of obesity. I blame medicine for the rates of chronically ill children in this country. Only those of you on the stream are the only ones who can hear me right now. I blame medicine for the healthcare costs. I blame medicine for the incredible rate of bankruptcies because of that very thing. And I'm going to give you an example. Part of sending a man into space back in the 1960s required the advancement in various areas of technology, not just rocket engines, but the supporting systems for rocket engines, to come up with a form of rubber, the insulation that exists the insulation that exists between stages, the insulation that exists in various areas inside the rocket where there is excessive vibration from the tremendous power of those engines, where the rubber is used to insulate physical shock throughout the system that could rip the rocket to pieces. So the technologists got together and came up with a form of rubber that would do that job. Well, that spilled into private industry in the area of tires for motor vehicles, so that they could start coming up with tires that would last 20,000 miles, 30,000 miles, 60,000 miles, and that came out of the space program. Just like the Polaroid camera came out of the space program. The refinements of camera technology, because they needed it for the space program. That began to be the improvement. It just improved everything for everybody. Now, you've got the medical industry that is dependent on money to survive, every bit as much as the rubber industry and the tire industry. They have in the tire industry forms of rubber that could make the tire on a car last 100,000 miles. But they don't make it. They made it in labs, they tested it out, but they don't make it because that would destroy the tire industry. So now in medicine, you've got the situation where you get people dependent upon the product that you're making, like low mileage tires. They're going to have to keep buying the tires. You get people who become dependent on the fact that if they don't do what you tell them to do, they're going to die, or worse, suffer some horrible, ignominious disease side effect and problems. You have a ready-made market that's going to be there until the day they die. Welcome back to K-Talk Radio. The commercials are over. This is the 27th day of August. My fourth son's birthday is today. Wow. 43. I wished him a happy birthday through texting, but I'll call him a little later. It's just cool. It's really cool. Anyway, so now back to this college fix that I was talking about. She says she's been reaching out to members of Congress to get them to amend this bill to make sure it includes medical schools and any partners of medical schools, because there's a bill in Congress to forbid mandatory COVID-19 vaccines. Now, how many other vaccines are absolutely mandatory to be able to attend a medical school or a nursing school? In all honesty, I don't know. But I don't see them in the news. Why don't, and I suppose there probably are some. Why aren't they hyped up like the COVID-19 vaccine? Why does the COVID-19 vaccine get all the attention? Probably in the last 2 weeks, talking to my patients, I think there's been at least 3 or 4 times, maybe 5, where someone said they just recently got over COVID. Or they know somebody that got COVID again for the 3rd time in a year. And they're just, beside themselves as to what they're going to do about it. And the thoughts that go through my mind when I hear these kinds of stories is, well, why aren't they talking about RSV? Why aren't they talking about the flu? Why aren't they talking about some bad summer cold that 10 years ago we would talk about, but we don't talk about bad summer colds anymore. We just talk about COVID. Well, you have to go back to Joseph Goebbels, the minister of propaganda in the Nazi regime. And he got most of his stuff from Hitler himself. It didn't all originate with Goebbels. He was just the mouthpiece for Hitler, in the sense of propaganda, that you tell somebody a lie over and over enough times, it becomes the truth. COVID, COVID, COVID. Now, back in April 2020, there was something that was called infectious fatality rate. Well, there's an infectious fatality rate exists in immunology. Infectious fatality rate simply means the rate of those who got an infection for a particular disease who died. So in other words, you have 100 people who are exposed to disease A. And after the disease ran its course with these people, 2 weeks, 3 weeks, a month, whatever, there's a certain percentage of them that died from it and another percentage that survived. And the percentage of them that died is the infectious fatality rate. There's something else called case fatality rate. Case fatality rate, and you don't hear this stuff anymore. You heard it back in the spring of 2020, but you don't hear it anymore because of the power of programming and brainwashing. Case fatality rate is, well, it looks like you've got COVID and the person dies from it because they were stuck on a ventilator or they were given remdesivir or whatever else. They died from it. Do we know for sure what they had? Yeah, it looks like it's COVID-19. That's a case fatality rate. Now, without understanding between the two, one, you prove through blood work, proving serum infection because of blood extraction tests. The other one, it looks like it. In the second week of April 2020, the infectious fatality rate for COVID was dropping like a rock through a vacuum. So they had to change how They diagnosed the disease. And so they went from blood tests, which is pretty good way of determining what's going on in the blood, to cases. Well, it looks like COVID-19, therefore it is. Well, he died from excessive bleeding in the intersection of the highway because his leg got ripped off in a motorcycle accident. Yeah, but he came in with a runny nose before he died. Looks like COVID. Now, I know that's an extreme example, but it happened. Now, coming up to date, even though COVID disappeared infectious testing wise in April of 2020, it's still everywhere now. But you don't hear about the flu. You don't hear about serious colds. You don't really hear that much about RSV or bronchitis or pneumonia or all the other things that made up the greater portion of respiratory disease and death prior to the appearance of COVID-19. You follow me on this, where this is going? Now, how I stopped asking, how do you know they died, or how do you know they had COVID-19? Or you, Mrs. Jones, how do you know you had COVID-19? I don't even ask that anymore because I know it's not COVID-19, because COVID-19 disappeared almost 5 years ago, just as cold and flu does every spring and summer. And you don't, please don't take my word for that. The evidence of what I'm saying is absolutely overwhelming and beyond argument. All you got to do is search for it. It's out there. My point is this. This is the power of white coat stethoscopic brainwashing and programming. Now, if you were to go to the pharmacy and get a home test for COVID-19, and you read the fine print, what does it say? As I have done. Now, the last time I did this was a year ago when a patient brought it into me. What did it say? It said, and I'm paraphrasing it, other forms of bacterial or viral infection can show a positive on this test. It does not necessarily mean you have COVID-19. Who reads the fine print? Who, you know, the last time you got a car on loan, did you read every last word of the fine print? If you're a very studious, financially oriented person, you probably did, but the majority of us, I don't think, do that. We just, give me my car. Where do I sign? How much is it going to cost me? Okay, give me the car. You have a cold, you have a flu that goes on for a week or two, and you have sinus congestion, and you have a sore throat, and you have a headache, and you start coughing, and it may be a dry cough, it may be a wet cough. You end up with an infection in your throat, but your immune system turns on. And if it's at least halfway effective, within a few days, you have built antibodies to whatever it is that you've been exposed to, and those antibodies target those bad guys. So the immune system looking, with a searchlight, oh, there it is, go get it and destroy it. And within a matter of hours to a matter of a few days, you're back in the pink and back to work or back to school. What did you have? Well, without serious blood examination, it's guesswork. But because we have bought into the COVID-19 scam, and the urgent care says, oh, you just have COVID-19. Here, go get this prescription filled and you'll be fine. You believe it. And why COVID-19 and not flu? Who's afraid of the flu? Why not just, well, it looks like you have a summer cold. You'll get over it. Give yourself some good rest, drink plenty of fluids, eat some chicken soup or whatever. And chicken soup is a good idea when you're sick for a number of reasons. Those Jewish grandmothers that would fix chicken soup and take it in the thermos down to their stock market son for lunch, who was suffering from a cold, knew what they were doing. But my point is this: there's still a fear of COVID-19. Why is there a fear of COVID-19? Because of social distancing with that stupid 6-foot thing. There's the fear of masking, where Fauci said, you need a mask. No, you don't need a mask. Yes, you do need a mask. No, one mask is not enough. Now you need 2 masks. Lockdowns. Oh, we found 3 kids in the school with COVID-19. All the kids have to stay home. That fear is still existing in the back of the minds of a lot of people. You never had fear of cold and flu, but there's still this inbred fear of COVID-19. And who knows what the next big baddie is going to be. Now they've found plague in California, the Yersinia pestis plague, and then chikungunya. They got a vaccine for it, but now it looks like it isn't that bad. Just like COVID isn't that bad for most people. What do they get? They get cold and flu symptoms. They get over it in a few days and everything's fine. Yeah, but I know these people with long COVID. Oh yeah, did they get the vaccine? How many boosters did they get? We now know what long COVID is. It's the poisoning from the vaccines. Yeah, but I know somebody that has long COVID and they said they didn't get the vaccine. Yeah, they probably said they didn't. More than likely, they're not telling you the truth. Is it possible for someone who didn't get the vaccine to have long COVID? Sure it is, because they had a lousy immune system in the first place. And the COVID vaccine made their immune system even worse. So now they're subject to all kinds of opportunistic infections that the immune system would have destroyed had they not got the vaccine. Am I sounding crazy? But this is what I deal with all the time. Now, I studied immunology in school. We use Guyton's physiology. There's 2 or 3 basic books of human physiology. And depending on what school you went to, would depend on what book of physiology they depend upon, but they all say about the same thing. The heart has 4 chambers. The arteries carry blood to the body. Veins bring blood back to the body. And as you go through the various systems that exist in the human body and get deeper and deeper and deeper into understanding the miraculous systems in which the human body works, the books almost say the same thing. They just say it a little differently. Now, my book, Guyton's Physiology, I don't remember what edition it is, but I think the latest might be the 11th edition. And you go to immunology among the pediatric crowd, children, they're developing immune systems, and it says very clearly, human infants do not develop the ability to produce an antibody until about 12 months of age. Well, so what? You're thinking. So what, Jack? We didn't vaccinate our children. So what? We don't vaccinate our children now. So what? Why should we worry about this? Because of what's coming. This isn't over with. Bill Gates is not going to sit back, oh, they got us. Klaus Schwab or his replacement, I forget the name. Yeah, they caught us. I guess we'll just go back to fishing. No, of course not. Of course, that's not the case. There's another one coming. I just want you to be prepared for it because it's going to come on like gangbusters and it's going to be scary. And it's going to be pushed by the same industry that is ripping you off now. Now, there are going to be those who on hearing what I had to say in today's program, oh, Jack's anti-medical. No, I'm not. Not at all. Medicine absolutely has its place, but you got to use your head. If I have a serious accident on the way to work and I need emergency care, I want to be in the best emergency room possible. And there's several of them throughout this entire state. Excellent medical trauma care. That's where you want to be if it's a traumatic situation. If you're having a heart attack, where do you want to be? At the local massage school? No, you want to be in the emergency room, getting the best emergency care that you can. It saved my brother's life. A little over a month ago, he essentially drops dead on the green, the putting green. And because his partner's an expert in CPR, saved my brother's life. He said my brother's heart stopped and started 8 times in 8 minutes, and it took 8 minutes for the EMTs to show up. They took over. Now, where's my brother today? Well, he's got a pacemaker defibrillator device in his chest. He's on some very serious meds. How do I feel about that? It's keeping him alive. How do you think I feel about it? And what is he doing? He's back out on the golf course, slowly integrating back into the quality of play that he was familiar with. Why? Because of the incredible, miraculous saving power of emergency rooms for serious crisis situations. My point is, most people who get sick are not in a crisis situation. If it's not a crisis where every moment could kill you, as in a serious heart attack in the emergency room, you might want to think of something else before you opt for drugs, like a lifestyle change. Start eating the foods that Mother Nature made instead of what Kraft makes. Start getting some exercise. You don't have to go crazy. Get out and walk for 30 minutes 2 or 3 times a week. Get an extra hour of sleep. We found out you don't need 8 hours. 6 to 7 hours, according to the latest sleep technology, is usually enough. I shoot for 7 hours. If I can get 7 hours of sleep, I'm fine the rest of the day. Clean up the water that you're drinking. Just little things here and there that make a lifestyle change. And don't eat anything that Mother Nature didn't make, unless it's an occasional snack. I'm not going to begrudge you for that. Mother Nature didn't make Cheetos. Anyway, you have to be careful when you eat foods for 2 major reasons. Because of the crap that's in them to make them taste like a food, and what's not in them that your body needs for nutritional support. Now, I'm accused of getting preachy at times, and I don't want to do that. But I do want to talk to you for a moment. I've got some notes here I want to share with you on vitamin C. I want to get to that, and then I want to get to the question we don't ask. The question we don't ask anymore. Especially if you find out somebody you know or somebody you know that knows somebody that they know suddenly came down with cancer that showed up and within 2 or 3 months they were dead, which does not usually happen with cancer. Now, vitamin C is a very misunderstood vitamin. And the FDA is responsible for this because they've decided that you rate any vitamin C in the marketplace by the amount of ascorbic acid that it contains. And ascorbic acid is an antioxidant. It's a preservative part of the C complex. This right here, my fingers that I'm using for the streamers, this would, like I'm holding onto a hamburger here. This would represent the whole vitamin C complex. The outer skin of the bun, the top bun and the bottom bun, the outer edge of that bun would be the ascorbic acid that's protecting that vitamin C complex from oxidation from the oxygen that's everywhere. That's what antioxidants do. Mother Nature put antioxidants into food, not so you can have them. You have your own antioxidant. Glutathione is the most powerful antioxidant your body makes. Mother Nature put antioxidants in food, not for you to get them, because your digestive system destroys it anyway. It's to preserve the food from oxidation until you eat it. Now, ascorbic acid is the antioxidant part of the vitamin C complex. And it's a preservative. And so when you refine out or synthesize this preservative, it's a mistake. The real vitamin C complex contains what are known as vitamin P factors that build the strength of the walls of the vessels, the blood vessels, which maintains vascular integrity. These are factors which, if you're deficient of this, you bruise easily, and you end up with a pink toothbrush when you brush your teeth, getting early scurvy in the gums. The blood vessels break down too easy and they bleed. Now, the P factors strengthen the vascular system, and they make the vessels tougher and more durable. Vitamin K is another part of the vitamin C complex. It promotes prothrombin. Prothrombin is the precursor of the clotting ability. It helps with coagulation when it needs to be done. Bleeders do not have enough vitamin K. And if you have plenty of vitamin K, it's used in the formation of protein that is then transported to the injured tissue to stop the bleeding. The J factor is another factor of the vitamin C complex. The J factor is the part of the C complex which increases the oxygen carrying capability of blood. Ascorbic acid doesn't do that. And if you have a cold and you want to get oxygen to your tissues where it oxidizes the toxins and carries them off as carbon dioxide and water, then that's where the C complex comes in. It also contains enzymes. The outstanding one being tyrosinase. That's organic copper. It's an adrenal activator, which is why when we're dealing with people who are adrenally fatigued, we definitely get them on whole food vitamin C. Ascorbic acid will not do that. But all these factors are important for the reasons mentioned. But in addition to all these factors, the vitamin C also contains ascorbic acid. And to say that ascorbic acid is vitamin C, as I said earlier, is to look at the steering wheel of a car and saying that this is the automobile, while it's just a small part of it. So, Standard Process has a product called Cataplex C. I take 3 of them every morning. I took my 3 for my breakfast this morning, along with a bunch of other stuff. They make it by removing the water and the fiber from raw whole foods, alfalfa, mushrooms, bone marrow, buckwheat. And this leaves a powder containing the nutrients that are in these foods. And this powder is then put into the tablets. And when you analyze the analyzation of these nutrients, let me continue my notes here. The analyzation of these nutrients, you find that it is about it's 0.01 ascorbic acid of the entire amount of these dried nutrients. 0.01, 1%. In fact, it contains about as much natural ascorbic acid as you would find in any vitamin C rich food, rose hips included. So if you were to eat an organic strawberry, an organic orange, based on weight, gram per gram, there's about the same amount of ascorbic acid in a tree ripened organic orange or a strawberry ripened organic strawberry as you would find in the Cataplex C tablet. It's not based on ascorbic acid, but that's how the federal government rates a vitamin C product, by how much ascorbic acid is present. This is all wrong. So if you look at a box of Cataplex C and read the ingredients to see all these foods that are in there. But ascorbic acid is listed because the federal government requires ascorbic acid content to be listed on any product that claims to be vitamin C. And you'll see, yeah, there's something playing at KTOG. You'll see that it contains 5 milligrams of vitamin C. So when I introduce Cataplex C to a new patient that's having cold and flu symptoms, and I suggest that they take this and they look at it, they usually don't read the label. Some of them do, but most of them don't, just like they don't read the labels of anything else they buy in the grocery store. And it says 5 milligrams. And they say, 5 milligrams? This thing only has 5 milligrams of vitamin C in it, or ascorbic acid? Yeah, and then I have to go through the vitamin C story. But the tablet that only has 5 milligrams of vitamin C in it also has 495 milligrams of all the other vitamin C complex factors, the P factor, vitamin K, vitamin J, enzymes, and what is really intriguing is all the unknown factors that are in there, which gives the vitamin C product, Cataplex C from Standard Process, its functional potency. And that's why I never not take my Cataplex C. Now, I just don't get sick. Thank goodness. It may be the 2 to 3 large glasses of raw milk I drink every day. That might have something to do with it. But I think it also has to do with some of the supplements I take, especially Cataplex C. Now, if you're interested, that is available at forbiddendoctor.com under Standard Process Products. And that's what I take for my vitamin C. I don't take these super high potency vitamin C products because they're just made by the addition of synthetic ascorbic acid to some food base, usually rose hips or acerola berries. And the manufacturers of these products know that the public demand is for so-called natural or organic products, so they put in organic rose hips or organic acerola berries because the public is looking for this, but then it's completely drowned with chemically made synthetic ascorbic acid. Now, is that any good for you? People know, that if a little bit is good for you, then a whole lot must be. So synthetic ascorbic acid is added to this food base in order to increase the potency of the product. In such a product, you might have 500 milligrams of synthetic ascorbic acid, or maybe only 25 milligrams of rose hips, but 500 milligrams of ascorbic acid. And these high potency products usually have a label that say natural or organic. This is because the synthetic ascorbic acid, which is a derivative of petroleum, mind you, like most of these products, contains carbon, and therefore it's chemically organic, although it's hardly a food. And in fact, it's a drug. So in order to put 500 milligrams of naturally occurring ascorbic acid into a tablet, the tablet would be the size of a ping pong ball. So they use synthetic ascorbic acid instead. Now, are there toxic effects from ascorbic acid used in moderate amounts? In other words, if you were to give your child a 500 milligram orange flavored ascorbic acid tablet in the morning before they go to school, is there toxic effects to that? I've never seen that. That's not the best source of vitamin C, but I've never seen any toxicity with that. And I haven't objected to it that much. I've just suggested Cataplex C instead because it's more of the full vitamin C complex. I haven't objected to it because people who are sick are simply too alkaline. I was in Whole Foods the other day because I wanted some good flavored bacon that is uncured. And I kind of wander through the rest of the stores I usually do, just seeing what they're offering. And in the water section, there's all these alkaline water, bottles of alkaline water. And I just stand there and shake my head. Are you out of your mind? What do you think that alkaline water is going to do when it hits an acidic stomach? And the idea is to have alkaline water so this alkaline stuff gets into the bloodstream. Bacteria thrive in alkalinity. So, what's that got to do with high potency synthetic vitamin C? Well, it acidifies the body. So, are you saying then that if we get a cold or a flu, we should take several of these synthetic high potency ascorbic acid tablets? No, I don't recommend that, but I understand why it works, because it acidifies the body to destroy the bacteria or the viral elements that might be bringing on the cold. Now, interestingly enough, this is why when you're sick, you should avoid citrus foods. Citrus juice does contain citric acid, but it's very quickly metabolized, leaving an alkaline ash. And so the person drinking orange juice ends up more alkaline than they were before. I do not recommend orange juice when you're sick. I don't recommend orange juice at all, unless it's about the same amount of juice you would drink if you ate a nice big old navel orange. The same thing with juicing in general. Unless you're doing some serious therapeutic cleansing, I don't recommend juicing as a whole, because you overwhelm the system with this. If you juice a bunch of carrots and all the other stuff that you're going to, and apples and pears and whatever else you juice with your carrot juice, you are getting a source of food into your body that your body is not normally able to handle, because it's designed to get those juices from the food that you eat that contains the fiber that slows down the absorption of the sugar that's in those food sources. But that's subject for another story. But I just want you to know that most vitamin C products in the marketplace out there are synthetic concentrated ascorbic acid that is derived from petroleum. Just like the B vitamins. The synthetic B vitamins are derived from petroleum. Boy, those Rockefellers had it, didn't they? And then Morris Fishbein, the president of the AMA, that changed the direction of medical school teaching and away from natural approaches to healthcare into pharmaceuticals back in the 1930s, 20s and 30s, into the 50s, in fact. Old Morris was around for some time in collusion with the Rockefellers. So, and if you can have people like Morris Fishbein and the Rockefellers, whose intention it was then to change the entire medical direction of America, why can't whole industries be just as heartless and just as evil as they were, with no regard whatsoever for the safety and the health of the average citizen? All right, I just got this text saying that ascorbic acid comes from corn. Yeah, corn syrup. Corn syrup mixed with sulfuric acid will produce ascorbic acid. But it's also a petroleum product. You can get ascorbic acid from petroleum. Synthetic, not the real ascorbic acid that you would get from citrus fruits. Did you know there's ascorbic acid in potatoes? Did you know that potato juice is one of the most concentrated forms of whole food vitamin C on the planet? Potato juice. Who juices potatoes? Yeah, potato juice. But of course, once you bake the potato or you fry the potato or the French fries, the vitamin C is destroyed. All right, now I want to mention this shockwave instrument that we have in the office. We're just starting to integrate it where there's some stubborn shoulder pain or bursitis, or tennis elbow, golfer's elbow, or lumbar disc herniations, or hip pain, or knee pain, or problems with the calf, with the tibial fibula connection, Achilles tendinopathy, plantar fasciitis, whatever. We are incorporating this device to try to help, because the technology involved with this shockwave therapy is just amazing. And what it does is it introduces inflammation into these areas that are already inflamed, but it does a different form of inflammation that actually speeds healing. Your body heals through the inflammatory process. That's where fevers come from. And when you turn up the heat, you activate the immune system, but you also activate the release of stem cells and growth factor, local growth factor in the particular tissue that you're dealing with. And so just the testimonies that are already showing up, testimonials regarding the use of this device. So we have it there for our, usually a good correction to the spine that I offer will get rid of these pains, get rid of the elbow pain, knee pain. In fact, knee surgery is the most canceled surgery in our office. And I never even touch the knees, but it's the result of bringing the body back into structural alignment that allows the knee to untwist and the contracted muscles to relax so that the knee joint can function correctly. But there, in some cases, enough ongoing inflammation over a long period of time that it needs a little extra help. So that's why we have included this device, this shockwave device, for rehabilitation. It's used in medical offices, orthopedic offices, sports medicine, whatever. And it's highly effective. It's non-invasive. There's no anesthetic. Each treatment lasts about 10 to 20 minutes, once every 2 or 3 days. 5 to 6 times as a course of treatment over a 2 to 3 week period. And generally speaking, pain that's been formed for a long time requires a certain period to help the body get over it. But depending on the severity of the problem, there is significant improvement that follows the use of this device. So you don't have to undress, except, if we're dealing with the shoulder or the back. We need to be able to get to that skin area. Usually recommend wearing a tank top. But the rest of the body, the elbows, ankles, wrists, knees, feet, easily accessible. And it has to be scheduled because it takes time to do it. And if you have a particular pain that I just got through describing there, we are offering the first treatment. Takes about 15 to 20 minutes without charge, just to introduce you to the system. If you want ongoing therapy, then it's going to cost some money, of course. But I think this is a great addition. I have looked at several. It's called extracorporeal. It just means outside the body. A therapy offered from outside the body rather than from the inside out. And so there's red light therapy now, and there's green light therapy and blue light therapy. And there's various forms of ultrasonic therapies. I like this one because what it does is it introduces micro tears into the tissue that stimulates the release of growth hormone and stem cells in the affected area. Now, do I call it stem cell therapy? No, of course not. That involves a greater concentration of stem cells. However, it is using your own stem cells to achieve a more rapid healing of these affected areas of the body. So I'm pretty excited about that, but they have to be scheduled. You have to call the office for an appointment to do that. 801-523-1890. All right. Now, and then the website. Boy, we've got just so much involved with the website now at forbiddendoctor.com. I've been working to rebuild the chiropractic portion of it. It kind of got destroyed. And so it needs to be rebuilt. I haven't been too happy about the fact that for some time now that hasn't been available as a part of research, but it's coming. All right, now in the remaining 15 minutes or so of the program, I want to talk about the forbidden question. I mentioned that at the beginning of the program. I haven't lost a patient to COVID any more than I've lost a patient to cold or flu. But we have lost several patients to the COVID vaccine. And now it's getting harder and harder to track those because there's so many of them that are dying from all-cause mortality. The numbers that are showing up in reliable statistical research, not just in our country, Canada, Mexico, Central South American countries on our side of the planet, as well as the other side, just an explosion of all-cause mortality. And proponents of this view argue that the vaccines that were introduced globally in late 2020 have triggered an unprecedented increase in cancer diagnosis, especially among younger people, with cancers presenting as usually aggressive and resistant to treatment. Now, when you hear the term turbo cancer, you get the idea that it grows quickly. That's true, but it's resistant to normal cancer treatment. And they point to a lot of anecdotal reports now from clinicians and pathologists who claim to have observed a rise in rate and of the rapidly progressing cancers, such as cholangiocarcinoma, lymphomas, triple-negative breast cancer, since the vaccine rolled out. Now, Dr. William Makis, a Canadian oncologist, you may be familiar with him if you've researched this stuff, has publicly stated that he and his colleagues have seen an explosion, that's the word they used, explosion of such cases, particularly in vaccinated individuals, describing cancers that can progress so rapidly that patients are dying within weeks of diagnosis. Dr. Angus Dalgleish, who's an oncologist in the UK, has expressed concerns about the resurgence of cancers in previously stable patients. Those who had cancer went into remission, have been in remission for years. Following a booster dose, suddenly it explodes. And then there's a few examples that I don't have time to get into that explain it a little bit more detail. But it was in remission, they get a booster, and suddenly it's there, and it's a little different. It's almost monstrous in how fast it grows to a terminal stage. Now, the proposed mechanism that links the mRNA vaccines to turbo cancers often center on the spike protein that's produced by the vaccine or the presence of trace contaminants like the simian virus 40 DNA fragments. Some argue that the spike protein may induce chronic inflammation or it impairs your own immune system's surveillance of the body, potentially reactivating late oncogenic viruses like Epstein-Barr or human papillovirus, which are known to contribute to certain kinds of cancers. Now, you remember the name Dr. Ryan Cole, the pathologist up in Idaho, I've talked about many times. He suggests that the mRNA vaccines could alter bone marrow function, leading to cancers that are unresponsive to conventional therapies. There was this Japanese study published last year reporting increased age-adjusted mortality rates for certain cancers, including ovarian, leukemia, prostate, and lip, oral, or pharyngeal cancers. The study was carried out in 2022, published 2 years later, coinciding with widespread third dose RNA vaccinations in Japan. Now, about a month ago, I talked about where Japan is in an absolute uproar for the tremendous explosion of all-cause mortality, especially cancer, that was not there before the vaccines. And these claims are supported by case reports and small studies. There's this Belgian study in Frontiers in Oncology described a mouse developing malignant lymphoma after receiving a high dose of Pfizer's vaccine, although the authors questioned that causality was not really established, but it was there. Another case involved a 65-year-old man diagnosed with non-Hodgkin lymphoma shortly after a Pfizer booster with similar reports of lymphomas emerging post-vaccination. Dr. Kashyap Patel, a community oncologist in South Carolina, had seen, quote, 7 cases of cholangiocarcinoma in a single year, a rare cancer typically affecting older individuals. It is now appearing in patients 20 to 30 years younger. So, what is the forbidden question? The question that we were all asking 2 years ago, when you find out somebody suddenly came down with some terrible sickness and has some intractable disease or pain, or died from some rapidly forming triple negative breast cancer, and then they're gone. What was the question we asked all the time? Did they get the vax? We don't seem to ask that much anymore. Because even the sheep among us notice the increase in cancer deaths, particularly the strange ones, like its occurrence in people way too young to be dealing with the type of cancer you see in the elderly. And then the turbo quality, dead within just a few months of some kinds of cancers that usually can last 5 years or more before they're terminal. So with now you can get into, here's something, if you've been wanting something to play around with AI, and whether you use ChatGPT or you use Grok or Metas or any of the other forms of AI, if you've been playing with AI, you find it's fascinating in the sense that you can go deeper and deeper. You can ask it a question. You can ask it a question like, what is 5 times 5? And then it comes back with 25. And if you could see the brain, it'd probably have a furrowed brow as to why are you asking me such a stupid question? Then you come back and say, thank you. What does 5 mean? And then you get a little deeper than that, you keep asking it questions based on the answers that it gives you. And you start out with something rather simplistic, and then you end up getting page after page of what is almost scary into how deeply they can analyze something, even in the sense of quantum realities. So, ask it about where are turbo cancers coming from. Start asking it questions about COVID-19 vaccinations. Ask it questions about the technology that's involved with mRNA vaccines. And then when the answer comes back, expand the answer a little bit further into another question, and you will be absolutely blown away how deep this can get. And then start asking it questions about the relationship between mRNA boosters and the appearance of all-cause mortality increases. If you've never done any research of any significant amount, that's a good way to start because you can do it on your computer at home. Now, I have done some statistical research myself with data that is supplied by statisticians, not me. But I've discovered the average person has in their family or group of friends, if you have a group of friends, say, as big as 250 people, and if you're involved in church groups and things like that, there's at least 250 people. And where, depending on whatever statistical system you're working with, some say as little as 100, some maybe even higher than that. Within that group, the possibility of somebody dying of cancer, let's say the 250, the possibility of somebody in that group of 250 dying of cancer in a 5-year period is about 1 to 2. Then you get into your AI and you start asking the possibility of that same group having received the COVID-19 vaccine. I'm telling you, you will be shocked at the answers you see. Now, the question, the forbidden question is, were they vaxxed? When we hear about some unusual cancer death or diagnosis, we typically don't ask the question for obvious reasons anymore. One of which is maybe we don't want to know the answer. 2 years ago, we did. So we could go, aha, I knew it. Oh, excuse me. I knew it. Today we don't. You know why we don't? Because it's frightening. The implications are absolutely terrifying. And the numbers continue to increase. And so at least half of the cancer deaths that I've seen in some statistical reports are considered out of the ordinary, with the deaths that are now suspected to be caused with the vaccine. The final vaccine caused deaths would at least double, triple, and I think in the next 2 or 3 years, quadruple. So shortly, K-Talk will be going to the top of the hour news. If you're interested in more on the shock therapy, you might want to try one. It takes about 15 minutes or so. The first one I will not charge you for. So you can see what's involved and you can decide then if you think it can help you. But you have to schedule it, 801-523-1890. We probably will not be taking any until after Labor Day next week. What else did I want to say? And then Cataplex C. You should be taking at least 3 of them a day. Little tiny brown pills. Available at forbiddendoctor.com. Cataplex C. Read the ingredients. And then read the ingredients of a synthetic form of vitamin C in the health food store. All right, that's it for K-Talk. For those of you who are on the stream, thank you. Thank you for being a part of this. I really appreciate it. I hope this is informative, and I hope it's helpful. And I hope you share it. I think the registered on the political one is approaching 100. I don't know the health on Facebook is several hundred. I'm approaching 1,000. So we want to keep growing that number as best we can. So I'm going to bid you a fond adieu until Monday of next week. You can always email the office, Jack Stockwell office @gmail.com, if there are particular subjects that you would like me to address on the radio program. I'd like to be able to do that. So keep your wits about you and study this stuff for yourself, as I always say.